Hey everyone, welcome back to my channel. My name is Kelly and I'm a physical therapist and I specialize in oncology, lymphedema, and women's health. The number one thing that I get asked every day is when is it safe or is it safe to get back into exercise after their breast cancer surgery? So in this video, I'm going to go through the exercises that I give the women that I work with to get back into movement and exercise safely. Now these exercises are going to be a little bit more moderate. I have made another video on easier exercises to start with. So if you're brand new out of surgery and haven't moved yet, or you're new to exercise, I would highly recommend going to check out those first. I will put a link down below for that video, and then you can come back to this video when you feel like you're ready to do so. Before you start any of these exercises, make sure you talk to your surgeon or your doctor about when it is safe for you to start exercise again. Once cleared, I hope these videos help you ease back into your exercise and get back to doing what you enjoy. Our main focuses with exercise after surgery are to get your pain down, get fluid moving, make sure we can get your range of motion back so you can get your arm in all positions, and avoid that forward posture or forward pulling position because that can cause shoulder issues, back issues, and neck issues long term. So these exercises are going to be specifically for helping improve to pull those shoulders back in the right alignment and getting all of your motion back. If you are still soon after surgery or you did not exercise before surgery, I would highly recommend starting really low in weights, really low in resistance, maybe doing all of these exercises without weight, and then easing in 1 pound, 2 pound, and gradually building up from there. Any exercise that you do, we really want to ease into. So if you have any symptoms like pain or any other swelling, you want to make sure you scale back, discontinue, and then talk to your doctor first before moving forward again. So this exercise is going to be a row. We're working on bringing your shoulder blades back together to open up the chest wall and to get the shoulder alignment improved as well as the neck posture. And so if you have a band, you're going to use that. If you don't have a band, you can do a bent over row. So I have mine around the door handle, and what I'm going to do is take a step backwards until I feel my elbow straight with just a little tension on the band to start. And from there, I'm just going to pull straight back, thinking about pinching my shoulder blades back in together or my elbows pinching back behind me, and then controlling back out. So squeezing back and down and then controlling back. You really want to make sure that you're not going up into your ears, but you're rather pulling straight down and back, opening up the chest and back down. And doing about 10 or so of those with good control. The harder the band, the harder the exercise is. Start with something light and easy with less tension and gradually build up. So the next exercise is going to be a wall push-up or a countertop push-up. You can work with either one, whatever feels best. So coming up to the wall, you want to be about shoulder distance away from the wall. Further back makes it harder, closer makes it easier, again, wherever you're at. But you're going to put your hands on the wall or on the countertop right out in front of you, and then you're going to allow yourself to fall inwards and then press back. Okay, what you want to try to do is avoid having your elbows go straight out towards the side. That's going to be pretty harsh on your shoulders and your chest. So to begin, you really want to make sure your elbows are down towards your sides a little bit more, and you're going to fall straight in and then press away. And doing about 10 or so of those can get you easing in. As you get better at it or as you get stronger and feel more comfortable, you can gradually come down more towards the floor or something lower that's sturdy. That'll be a little bit more challenging going against gravity. The next exercise is going to involve a stability ball, and it's going to be a prone T or a reverse fly, and I will show you both ways. So if you do have a ball, again, if you're soon after surgery, you don't want a lot of pressure on here, so you're going to place the ball a little bit more in your abdomen area rather than your chest. So what we'll do is lean over more onto your stomach area or whatever you're comfortable with. And if you feel comfortable, you can bring your knees off the ground, but if you have any balance concerns, you can keep your knees down all the way. So with your knees down or up and the ball on your stomach, you're going to put your arms out to the side in a T position. You don't need to bring your head way up or look way down. Just for this video so you can hear me, I'm turning my head. But you can really just look straight in front of you on the floor. Keep your feet wide so that you have more balance. And with the arms out to the side, you're gonna raise up towards the ceiling. Feel the pinch between your shoulder blades, and then come back down. Again, it's not just your arm. We really want that squeeze of those shoulder blades. So all the way down, all the way up. And again, I'm gonna turn so you can see my back a little bit. Out to the side, up, and control down. Now, if you don't have a ball like that to use, you can just doing a bent over fly, either at the back of the counter or the couch, or if you're comfortable with your balance, you can do both arms at the same time. We want to have your back flat and parallel to the ground, so you want to be bent over in this position as much as possible. And you're going to have your arms out towards the side. And what you're going to do is you're going to bring both arms straight up like you would over the ball, squeeze your shoulder blades, and then back down. So all the way up, feel like you're pinching your shoulder blades together, and back down. So turn, you can see a little bit more, and control back down. So the next exercise is gonna be a chest press. Again, you're gonna want another dumbbell. You can have 2 dumbbells, whatever works for you. If you don't have a light enough dumbbell, you can get a little bit of heavier dumbbell and just do with 1 dumbbell. So I'm gonna show you like that. So you're gonna be on your back, and with your dumbbell or without weight, you're gonna bring your arms to your side and you're gonna press straight up towards the ceiling. So coming back down and pressing up. When you press up, you wanna make sure you're fully extending your elbows and then coming down with your elbows at your side. If you have 2 dumbbells in your hands, it's gonna be a little bit more out to the side and then press up, but make sure that you have control in whatever way that you choose to do. So the next exercise is gonna be using the band as well, but instead of putting it low in the door, we're gonna put it up high. So make sure that you have a knot in your band, or you use a type of band that you have something to grip into, and then you can open up your door and put it over the top of the door. And then what you'll do is shut it, make sure it shuts well, and the band should get stuck in the door if it closes well. From there, we're gonna do a shoulder extension. So with the row, we were working on your middle trap muscles, which are the ones right between your shoulder blades. These ones are your lower traps, which also help pull and rotate your shoulder blades down and back to open up the chest. So the band up high, grab onto the ends, make sure your elbows are straight out in front of you. And then what we're gonna do, keep your shoulders down into your sides. And you're gonna pull the band straight down to your sides, and then gently come back and up. So again, straight down to your sides and gently come back up. You don't wanna let your shoulders hike when you come up or down. So back and down, pull down to your sides, and control back. For the next one, we're gonna keep the band up high in the same position. We're gonna work on the triceps. So what you're gonna do is you're going to put your elbows by your sides. You do want a little tension on the band when you're there. So bring your elbows by your side, and they're gonna stay locked at your sides the whole time. From there, you're going to just straighten your elbows down. So pulling the band straight down, and then letting your elbow bend. So I'm not bringing my elbow up away from my body. I'm leaving it down by my sides, and I'm just straightening my elbow down, letting it bend back up. So all the way down, all the way up. And so yeah, step away so you can see me a little bit better. Elbows by my side, straight down to my sides, and then back up and in. And doing about 10 of those with good control on the way back up. Now, if you don't have a band at home, but you do have a dumbbell, or again, I'm using my can of soup, so whatever works for you, start light. You can do a bent over tricep extension. So same muscle we're working at, but a different thing. So you're gonna bend over similar to you would with the other ones. You're gonna keep your elbow by your side with this one as well. As parallel as you can get your chest to the floor. If you have tight hamstrings like I do, that's okay, just get as far as you can. So elbow by your side, all you're gonna do is straighten your elbow back behind you and then let it bend back down. So straighten, feel the tightness in the back of the arm, and then control back down just like that. And that's another way to get the same muscle group. So the next exercise is going to be a lat pull down. So we're going to again use our band up tall. This will be a challenging one to do with a dumbbell. So if you don't have a band, you can do it at a gym or you can just skip this one. But we're going to do a pull down for the lat muscles, which are these big wing muscles under your arm. These ones tend to get tight after surgery and definitely after radiation. And so we're going to be working them, but if they feel really tight, you may want to go ahead and watch my stretching video, which I'll put a link down below, and get those stretched out before you work into a lot of strengthening. So standing or sitting sometimes gives you a little bit more motion depending on how high your doors are. You're going to hold up a little bit higher and choke up a little bit more on this one. And when you pull down, you're going to basically think about you're doing a pull up that you normally would. You're going to pull the bands to your sides, kind of feeling your shoulder blades squeeze down and back, and then you're going to control back up. So you're going to squeeze down to the sides and pull back up. So if you were sitting, I'm just gonna squat down so you can see me a little bit lower. You're gonna pull down and back. You're gonna think about those shoulder blades pulling down into your sides and back down. So those are some moderate exercises that you can do to work back into your normal routines after your breast cancer surgery. If you found this video helpful, please press the like button. And if you're interested in more videos on oncology, lymphedema, or women's health, be sure to subscribe. I'll see you all at the next video. Thanks everyone.